So a question we get a lot when clients hire us is, should I use my own health insurance or should I use your doctors, meaning our doctors, because we have doctors we work with across California? And the answer is, it depends. And it depends on a lot of things. It depends on if you're already treating. It depends on, your own health insurance doctors. Did they already tell you that, you know what, go home, take ibuprofen, you'll be fine? Have they set you up with physical therapy? Have they sent you to the chiropractor? Have they sent you to a specialist? If your health insurance is not doing these things and you're still in pain, then the obvious answer is we can't use your health insurance because they're not going to do anything. You got to go see our doctors. A lot of times, the managed healthcare system meaning HMOs, PPOs, those doctors aren't making decisions for themselves. No. Those doctors are making decisions based on what the insurance company, the health insurance company, approves. And so sometimes we need to walk and step outside of that world, step outside of the health insurance world and go into a different realm where we're dealing with our doctors, where our doctors don't report to health insurance. Well, they will treat you regardless of what the health insurance says. If you need the treatment, they're going to give it to you. And so it streamlines the process, your case and your injury treatment, much, much faster than you would with the health insurance. As you know, health insurance companies, they require your PCP to send a referral. Then the referral has to be approved. Then the referral goes back to their primary care physician, and then maybe they'll get you an x-ray or an MRI. And then after you do that, the primary care physician will then look at the MRI reports and determine whether they're going to send you to a specialist. Did I just explain to you those three things? Going to your primary care, getting the MRI, seeing your primary care, and then being referred to a specialist. Usually, best case scenario, that takes 3 months, maybe 6 months. So managed healthcare, PPOs, HMOs, Medi-Cal, Medicare, those things are really hard to work within, which is why sometimes our clients are advised not to use that system. And sometimes they just don't want to use that system because it takes so much longer. And we're happy to connect you with our doctors that we work with across California. So here's a perfect example, real life example of a client of ours that was using her health insurance and hadn't hired a lawyer. The first year of her accident, she was seeing a doctor, her primary care physician. She was going to physical therapy, but the primary care doctor said that he can't get approved physical therapy anymore. Can you believe that? The doctor says that the patient needs physical therapy and the health insurance, the managed healthcare system, is not approving it. So at any rate, she was paying for physical therapy out of pocket. A year goes by and she hasn't hired a lawyer. She's just kind of paying out of pocket, dealing with her primary care. Finally, she's basically running out of money. She calls me. She's still having issues with the injuries that she's having. She's still having issues with her symptoms from the accident a year earlier. She was having numbness and tingling going through her arms, which is usually the result of an impingement in the cervical spine. And the doctor, was trying to get physical therapy approved, but there was only so much the managed healthcare, her HMO, would approve, so she was paying out of pocket. She called me, she hired us, we immediately got her to our doctors. We got all her prior records from her primary care physician and the physical therapy. We got those and we sent those over to our doctor, our pain management doctor. The doctor saw all that. He sent her immediately to an MRI within a week. MRI results came back. The doctor, the pain management doctor, says, look, she has an impingement. There's a reason why she's feeling numbness and tingling going into her arms. She needs to do something about it. It's not going to stop. A year had gone by and hadn't gotten any better with passive treatment and physical therapy. So the pain management doctor, over the next 3 or 4 months, I believe it was 4 months, ends up giving her 3 injections. Those injections then go on to make her so much better. That case was closed. We were able to get her not $50,000, not $100,000, $235,000. We just sold that case. Sure, it took a lot of time. Sure, we had to litigate the case, but the client was getting nowhere with their own health insurance, absolutely nowhere. So we sent her to our doctors. We ended up filing a lawsuit because they weren't believing us. Then they had to take her deposition. They had to send my client to their doctor, meaning the insurance company's doctor, which is basically a hired doctor, to say that my client's not injured. Nonetheless, even though their doctor said that my client wasn't injured, they settled the case for $235,000. And the rest is history. She's super excited. You know, she got the treatment she needed, although later. She got money to get her compensated. And now, you know, she ended up using that money as down payment for her house. Guys, my name is Chris Mova, and consider following me. I don't know, tap this thing or that thing down there. I'm going to be putting out a lot of content over the next few months to help you guys decide how you want to pursue your personal injury case and give you a lot of free content.